Stroke, otherwise known as brain attack, is the fourth leading cause for the death and disability in this country. This occurs in both rural area as well as urban area. That means nobody is spared. But this is most common among the elderly, usually above the age of 50 or 60 years. Though we have what are known as young strokes occurring below the 40 years of age. The stroke could be of ischemic type, that means lack of blood supply to the particular area of the brain, or it could be hemorrhagic, where the blood vessel ruptures leading to hemorrhage. The stroke is preventable, and that is the most important aspect. There are certain risk factors. These risk factors have to be controlled. The major risk factor for the stroke is hypertension, that is a high blood pressure, diabetes mellitus, hypercholesterolemia or hyperlipidemia, the heart diseases with irregular heart, smoking and alcohol. All these factors could be prevented. So once a person has a stroke, immediately such patients have to be shifted to the emergency ward with an ambulance, and it should be within 3 hours. Why we say 3 hours? 3 hours is called golden hour for stroke patients. And if the patient lands in the hospital within 3 hours, immediately a drug can be given to lyse the thrombus, or thrombolysis can be done. And these patients can be reversed almost completely without any deficit. And that should be our objective. So make the diagnosis early, treat them with the thrombolysis, and if the patient requires, we can even operate on those patients, remove the thrombus by a mechanical way, which is known as mechanical thrombectomy, which can be done effectively, and thereby one can minimize the deficit as well as reduce the mortality. So stroke is actually a brain attack which is similar to heart attack. So we need to create awareness among the people. Let us all join for the Bangalore run for creating the stroke awareness on 16th December at Taban Park, and this is brought about by Apollo Stroke Awareness Program 2018.